Great. Thanks so much, Kate. It's really fun to be here. I, as Kate said, work for Community Solutions. We are working with 71 communities, including 5 full states, who have answered the question, yes, they're ready for zero by committing to end veteran homelessness this year and chronic homelessness by the end of 2016. You can go on to the next slide. And next slide. So basically, everything we work on comes down to this. This is a picture of Ed Givens, who lived on the streets of Los Angeles on Skid Row for 30 years drinking. And after 30 years, we did a registry week where we went and screened everyone we could find who was homeless on Skid Row, and Ed came out right at the top of the list. As you can imagine, he had a lot of health issues, and when he got to the top of the list, he moved into housing. And that's, to me, what Housing First is. And everything we talk about as far as ending veteran homelessness, ending all homelessness, is all Housing First. When you're at the top of the list, the person with the highest acuity, most issues, the highest number on your screening score, when housing comes open, you get the next available housing. He moved into housing while he was still drinking. He gets in. He tells his case manager, I feel terrible. Can you help me do detox? And go to the next slide. This is what he looked like a couple of months later when he did detox and, had a homeless zone. And everything I talk about is based on the idea that you can get stability and sobriety back in your life when you have a home. It's very hard to do that before you get a home or to earn a home. So everything I'm going to talk about is Housing First. Next slide. So this is the Mayor's Challenge, the Opening Doors goals, the Zero 2016 goal. It's the goals that the National Alliance is working on, that really communities commit to ending veteran homelessness this year, no later than December 31st of this year, and building on that momentum to end chronic homelessness by 2016. That's what our campaign communities will be doing. The government has said, let's do 2017. So we're sticking with that, but it's 2016, 2017. So things we learned during this campaign are really only do what makes sense. Let the data nerds lead the strategy, and those are 2 of the data folks that I work with, and they really push us to do the things that work. Next slide. We also learned that there are some things that you can do as a community that make it really more likely that you'll be ending homelessness. The first one is that you use mainstream services. You can go to the next slide. You use mainstream service funding like CDBG, like ESG, and you cannot solve homelessness with homeless set-asides. Next slide. That shared data, and that's what we're going to be talking about here, is making sure that everyone in your community has access to the data that you're gathering around who's homeless, and you find ways either through releasing information, through really crafting how your HIPAA understanding is, but you make sure that everyone has access to that list of people who are homeless, and that you're using data to drive decision making. You shouldn't be paying for anything in your community that's not working. The third is that you're setting eligibility for permanent supportive housing, whether it's VASH or other supportive housing. You're setting that at the community level. That's where you can make a huge difference. Next slide. You have to have a by name list of your homeless neighbors. I'm going to spend a couple minutes talking about this because this is a big part of what we're talking about here. In order to end homelessness, and these 5 things are, when we did self-evaluations of communities, these are the 5 things that were most predictive of communities that were seriously reducing homelessness. And this is one of the most important, that you have a by name list. And that by name list is developed by doing what we call a registry week, or a real-time. A lot of people did this during their point in time where they went out. They had a screening tool that they used to triage people. They talked to everyone who was homeless. They have a by name list instead of just an aggregated list. You have a by name list, and that's constantly being updated with your outreach, whether it's through the VA or whether it's through your regular outreach workers. You're constantly updating. This is a dynamic list. It's not a waiting list. It's a list that drives who gets the next housing. When you get to the top of the list and a housing resource comes available, the person with the highest acuity, the highest needs, gets that, regardless of whether they're drinking or whether they're quote unquote ready for housing. They get the housing and they become ready for it as they live there. And then the number one thing is what I talked about before with Ed Givens, that community-wide you are implementing housing first as the way that you are deciding who gets the next housing. And as I said, housing first is simply this: the person with the highest acuity gets the next available housing resource that comes along. It's simple to do. It's simple to talk about. One of the most joyous things you'll ever do is move people in to housing, and one of the hardest things you'll ever do is keep people in housing. So housing first is just absolutely essential. Next slide. So who has to be at the table? One of the things we learned, we did the 100,000 Homes campaign for 4 years, and we also learned that the communities that had the best chance of reducing homelessness were communities that had the Veterans Affairs, the Continuum of Care, and the Housing Authority at the table. And so when we invited people to apply to be part of Zero 2016, we told the communities that that they had to get a signature signing on from the VA, the COC, and the Housing Authority, because truthfully, the VA has a lot of the resources that you'll be using for ending veteran homelessness. The Housing Authority has a lot of the resources that will be used for ending veteran homelessness. And the COC has control of PSH, Shelter Plus Care. A lot of times it's within the COC that's controlled. So in order to do this, that's who needs to be at the table. Next slide. And here is something that's really, really important for this work. We have federal partners. This happens to be a picture, just pulled it up. It's a picture of folks from the U.S. Interagency Council on Homelessness and Housing and Urban Development together holding up a takedown target of how many veterans and how many chronically homeless people our communities have committed to house by the end of 2016. So I want to talk a little bit about how that works. So in your community, you're probably about at the point where you have a pretty good idea of your 2015 point in time numbers. So what communities who are part of this, and Krista can talk about this if she'd like to, but communities that are part of Zero in 2016 take their number of chronically homeless individuals they have from their point in time. The national average of inflow for people moving into chronic homelessness is about 1.3. That's about a 30% more people will flow in during the year. So you know that in order to end homelessness for all the chronically homeless individuals, you need to have, say you had 100 people who were chronically homeless, you'd use your inflow number of 1.3, and so 130 people need to be housed by the end of 2016. There are about 21 months left, and so you'd set your takedown target by dividing your total number of people who need to be housed, 130, by 21, and that's how many people you need to get housed every month. For veterans, again, you go to your point in time, you look at your veteran numbers for chronically homeless veterans. Your VA Medical Center has a number that they use as an inflow number, a multiplier. It's usually between 2 and 3. So if you have 30 veterans who are homeless and your multiplier is 3, you say, all right, we have to house 90 veterans by the end of this year. There are 9 months left in 2015. You'd have to house 10 veterans every month to get to 0. When we talk about getting to 0, ending veteran homelessness, I don't know if you could go to the next slide. I'm not sure if I put this in or not. And you can just see this is just during the 100,000 Homes campaign, communities set as a goal to house 2.5% of their chronically homeless population. For veterans, it's really, right now, it's about 10% every month needs to be housed, and 5% for chronically homeless. You can go to the next slide. Oh, wow, look at that. I put in a slide of this. I should have just gone on ahead and followed my slides. So this is what I've just talked about, the VA multiplier. It's 8 or 9 months away, so this is how you determine your monthly target based on your 2015 point in time. Next slide. So this is what I really hope for. I hope that we can expand our vision to include every veteran, whether they look like Ed Givens on the streets of Skid Row, or really whether they are a young guy who just came back from the Middle East who just can't quite get his feet under him. We have an opportunity right now to end veteran homelessness. I think Michelle Obama said it really wonderfully at the National Alliance Conference last year when she said, we will end veteran homelessness in 2015, and that will be a proof point for us that we can end all homelessness. So that's what we're about. Next slide. That is Ed Givens, who, when we celebrated the end of the 100,000 Homes campaign, came to the White House for our celebration, and I got to meet him. So it was really, really cool. I think that's the end. I'll stop there. Oh, you can you just
have a couple more.
Yeah. So whenever I talk to people, I ask them to make it. You can go on to the next slide. I ask people to make a commitment to to take this home with you. Next slide. I am fiercely committed to ending homelessness. Next slide. And what I've done in communities who are willing to pledge to end veteran homelessness is, and Kate has seen me do this, I give everybody a toy soldier. You can get them at Dollar Tree, 30 of them for $1.
I've got it. I've got it right here on my desk.
Yes, and I give everybody, a veteran, a toy soldier and say, listen, if you're willing to make this commitment to end veteran homelessness, pick up your toy soldier, stand up, and make that commitment. And Chris has seen me do this too. I commission people by no power other than I think this is the right thing to do. And next slide. And I send people out to do the work of ending veteran homelessness. And I tell them to put their toy soldier on their desk to remind them that this is the work they're about.